Today's webinar is Increasing Equity in Global Health, and we're very pleased to have three outstanding speakers who are going to address this pressing structural obstacle to achieving global health outcomes. We know that inequities or inequalities, slight difference but important differences, they're contributing to significant and persistent disparities in global health outcomes. But global health is, by its nature, ideally suited to be able to apply the multidisciplinary skills we have to address these challenges, to change the policies that make these structural obstacles pressing and persistent challenge to global health outcomes around the world. So what I'm going to do is just to quickly announce the three speakers we have in the order in which they'll appear. The first is Dr. Peter Donker. Dr. Donker is a professor of oral and maxillofacial surgery at the Kwame Nkrumah University of Science and Technology in Kumasi, Ghana. He's the former vice president of the university and the founding chair of the African Forum for Research and Education in Health. And after Dr. Donker, Dr. Bethany Het-Gauthier. Dr. Gauthier is the associate professor at the Harvard Chan School of Public Health, and she's also the chair of CUGH's working group on addressing global health inequities. And finally, we're going to have Zoe Mullen. Ms. Mullen is the editor of the Lancet Global Health. Zoe's going to talk about the role of journals in addressing these inequities. And Zoe is the originator of this series of webinars. So with that, I'm going to turn it over to Dr. Donker to start. Dr. Donker, thank you for being here, and over to you.
Thank you, Keith. The title of my talk is Inequalities in Global Health Partnerships and Solutions to Address Them. Low-middle income countries face a number of challenges, including a high burden of disease, inadequate human and material resources, cultural and gender impediments, which endanger global health. They lack training and mentorship opportunities and have limitations with access to research grants, data, and experience with scientific authorship. So global health partnerships can be beneficial in that they help build or strengthen local capacity and help mobilize resources which may be unavailable. They help in the pooling of resources and provide a platform for information sharing, and also provide opportunities for research. At the onset of most partnerships, you see that low-middle income country institutions and the high-income country partners have a resource mismatch in terms of human, material, and financial resources. There will be cultural differences, which can lead to misunderstandings. There will be skewed training opportunities in favor of the high-income institutions, and there's inequitable access to information, and there's almost invariably imbalance in the experience with scientific authorship. Now, to build these partnerships, you need to have certain indicators for success, and examples include an improvement in, say, the grant management infrastructure of the low-middle income country, an increase in the number of successful grant applications, having more LMIC investigators becoming PIs or co-PIs on these applications, increase in publications, as well as having more LMIC lead authors, and embedding of the project activities into national and institutional programs. Now, when partnerships begin to falter, you have a persistence of power imbalance in the areas of resource control. There may be authorship disputes on publications as to where one ought to be placed, if at all. There's an overdependence of the LMIC partners on HIC counterparts. There'll be an absence of a plan for mutual growth of both parties. And remind you, both parties need to grow. And there may be no sustainable plans beyond the initial period. So one needs to choose partners carefully. You need to identify the skills and knowledge that may be lacking, the personalities that are involved, whether one can work with them, the resources that need to be assembled from the outset, and how any benefits are to be shared, if any, what hurdles need to be overcome, and how readily the terms of the collaboration are going to be adhered to. Now, to build an equitable partnership, there needs to be institutional leadership. So institutions must buy in at the highest level. At the vice chancellor, dean, and all these must be committed. There need to be faculty champions who actually lead the whole process within an institution on both sides. It should be ethical, respectful of each other, and there should be sensitivity to the cultural practices within the countries. There needs to be a formal structure of the partnership so that you have a governance structure, you have maybe committees, you have a system for communicating, a plan for sharing resources, benefits, agreements on authorship, etc., etc. At the outset, there should be a detailed assessment of the needs of both partners, and then remembering that everyone comes in with some goal in mind. Should be training opportunities that are on offer must be identified, and also there should be a sustainability plan. And of course, more importantly, there should be a plan for evaluating the performance of the partnership. Now, sustaining these partnerships will only come about if the goals are clearly set out, and the ground rules for managing the partnership are also well laid out. Trust and confidence building should be ongoing. Feedback, communication, and recognition of each other's role is very important. And the metrics for evaluating the partnership should be also laid out. There should be patience and perseverance. Now, to conclude, LMIC seeking to improve the health status and human development index of the people will benefit from equitable partnerships. Ethical, formal, structured, open, and culturally sensitive engagements with high-income country partners are beneficial. There should be built-in plans for power, benefits, resource information sharing, as well as sustainability. And these are important for success. And the goals of the partnership need, as much as possible, be incorporated into the health and/or education plans and the budget cycles of host country to ensure sustainability. And regular review of the partnership is important so that necessary adjustments are made. Thank you very much. And at this point, I'd like to introduce Bethany Head-Gauthier from Harvard, who will give the next talk. Thank you.
Thank you, Peter, and thank you for the invitation to join this group. I want to start off by saying I don't consider myself an expert on this topic, but I am an active learner, and a lot of that comes from self-reflection. And so what I'm going to talk about today reflects that, and we'll really talk about a relatively narrow focus of this conversation, but hopefully is helpful for us to think about more broadly in this topic. So when I think about equity in research, one of the starting points for me is to just remind myself that even though it's not always tangible, that research and global health research specifically is a field of commodities, and they're not always tangible things. So, in other industries, it might be something like gold, a resource that's a tangible commodity. In research, the commodities can be tangible, things like funding, but they may be less tangible and less more difficult to quantify. So things like networks can be a commodity within global health research. Authorship can be a commodity. And it's important to think about any of these things, occupations, authorships, presentations at conferences, as things that can be earned. But as we look at it from the lens of equity and power dynamics, these are also things that can be traded, can be sold. They're really, the way that they move hands within the field of research reflects very much the power structures that are in place. The Schiffman article summarizes a lot of the different capital that leads to power dynamics in research, and I think Peter did a great job highlighting many of these, and so I won't duplicate what he said. But as we think about the different types of capital and power dynamics within global health research, for me, it's helpful to think about how these come into play within my own work, how these come into play and are reinforced by my institutions, and how I can mitigate some of these capitals or share some of this capital within my partnerships. Peter summarized many of these barriers to equity in global health research. And so again, I won't duplicate what he's talked about, but one of the things as we talk about what these barriers might be to equity in global health research, it's important to recognize that this really needs to be addressed from multiple key players' vantage points. And so all of us have a role in this: funders, journals and editors, high-income country research and research institutions, our LMIC researchers and research institutions, governments, international governing bodies, all have a role. And as I mentioned at the start, I'm really going to focus on, from my perspective and from my experience, roles of high-income country researchers and research institutions. So I try as best I can to engage in research partnerships that reflect these values of equity, reflect the values of partnership that Peter described. I try to have the reflection and the supports in place that Peter recommended that we put in place, things like evaluating our partnerships and looking at how we benefit each other. And that is a work in progress always, but something I strive towards. And one of the interesting things that's emerged for me over the last 10 years is there's definitely a community that supports that work and encourages me to do that work. However, this is just a snapshot of some of the feedback I've received from within my own institution directly related to those activities. So things like, this will ruin your chances for promotion. We cannot ask our junior faculty to do this type of work. We need you to be available for Harvard students. You cannot spend so much time out of country. And as I've gotten this feedback over the years and tried to navigate my place within my own institution while I conduct research the way that I believe it should be conducted, it's really got me to think more about, do high-income country academic structures perpetuate bad behavior? And as maybe 5 years ago, I started talking about this more in my own work. The first thing I heard was, well, where's the data for this? And so, just a couple of things that I think frame this discussion. One is the story from Emory University, where scientists from Kenya sued the UK Government Wellcome Trust because they felt like they had been discriminated within the workplace. And I just recently heard that even though they won the initial lawsuit, this was just turned over in a court of appeals. But I thought the statement from the original ruling, from the judge from that original ruling, is very interesting to reflect on in this conversation. So the systemic discrimination had significant detrimental effect on the researchers. They've not only lost a chance to renew their employment contracts connected to scholarship to complete their studies, but have lost significant research outcomes as a result of these discriminative practices. We also tried to create evidence around how high-income country academic institutions shape equity in global health by looking at dynamics and authorship. So this is a paper that was recently published where we looked at 7,100 articles about health in Africa. And so what you'll see here is the representation of researchers from the country where the research was conducted compared to the overall authorship list. So the first bar represents 43,000 authors across the 7,100 articles, and slightly over half of all authors were from the country that the research was about, and that persisted across all of the key authorship positions on the paper. However, and interestingly, as soon as any of the collaborators on the paper were from a top US university, the representation dropped overall from 50% to around 38%, and dropped most pronounced in the first and senior authorship position. And to me, this really does demonstrate how certain institutions and individuals within those institutions might be contributing to issues around inequity. We explored this more deeply at a Radcliffe Exploratory seminar. This is just to highlight some of the colleagues and institutions that were represented in this discussion. And we came up at the end of that 2-day seminar with a set of recommendations that we thought should be considered by institutions that are conducting global health to promote better equity and promote in partnerships. What we first did is identified key areas that we thought were necessary for fair partnerships. Things like embedding, so that's allowing colleagues, researchers to spend the adequate amount of time needed to form these strong partnerships and to support their teams on the ground. Issues around authorship, looking at who is publishing and how they're featured. We identified barriers to each of these key areas and then tried to come up with some concrete solutions that universities could adopt. So for example, within authorship, one of our recommendations is that universities should value authorship that includes low and middle income country collaborators and prominent positions, and that they should question publications that do not have local collaborators when a faculty member is up for review. I encourage you to read this paper in full just to see the broad range of recommendations on this topic. So what are we trying to do at this point? So we are working with different groups, including, as Keith mentioned, with CUGH, to advocate for adoption of these principles into promotion and review committees. Part of this is just broader awareness raising. So, I appreciate this opportunity, and I hope that all of us sitting around the world can start shaking cages to try and encourage groups to consider these promotion changes. And then we're working with university leadership to discuss the viability of these recommendations and how they might be made more viable to be integrated within promotion review. On individual level, I want to encourage anyone on this call to highlight these aspects of their work in their CV. So when I was going up for promotion, I was discouraged from putting certain things into my CV because it didn't fit into what is typically valued in promotion and review. But if we all put it in our CVs, then hopefully that normalizes what we expect to see within global health faculty conducting fair and equitable research. The hope is to have a session on this at the CUGH satellite session, and I'll make sure that this is available for all of you on the webinar, that you could participate, and we're looking for ways for that to happen virtually, virtual participation. And I just want to end with this quote, again, something that's really for my self-reflection from Dr. Kalinga. So why don't more African researchers speak up? Many do, but the real question is, why won't Western institutions, funders listen to us? My experience shows that junior Indigenous staff are routinely disregarded. Senior academics will turn to prominent European experts who hardly visit their country of expertise. The very foundation of these partnerships reinforces the powers of those who bring the funding, and African researchers know the flimsiness of their careers. So with that, I'm pleased to pass this on to Zoe Mullen from the Global Health to finish off the talks.
Thanks very much, Bethany. Okay, yeah, so I'm now going to be talking as a journal editor. So one of the other key players in trying to ensure equity in global health that Bethany mentioned are journals. So that's where I come in. And I think there are 4 key areas that I want to talk about today. So I'll kick off with the one that I think we have the most control over, because there are some aspects that we can have more influence on as journal editors and some that we can have less on. So if I kick off with international advisory boards, so these are the boards where we have advisors from around the world who can give us some direction on the types of strategies and policies that the journals are following. They don't necessarily do the peer review for us, but they are a sort of sanity check on whether we're running the journal in a way that's appropriate for the audience. So this is an area that the editor has total control over. So I, as an editor, can invite whomever I want, as long as they are, qualified for the role, from any country and around the world. So we've tried to ensure at Lancet Global Health that we have a good balance of members from both high income and low middle income countries, and we've just about got the balance, I think about 50-50 from LMIC and HICs at the moment. Also, there are other issues to consider when thinking about inclusion and diversity. So we're also trying to make sure that we have around 50% male and female participation on the board. And again, we've just about managed that this year. And also a range of career stages, because we don't want all of our board members to be, you know, the very top senior people. We want to give people with who are just starting out in their careers, maybe the chance to give us their views, because they're equally as valid. So it can be done. It just takes some mindfulness, I think, on the part of the of an editor to make sure that, you know, you have representation from the audience that you're expecting to have an influence on. So Bethany mentioned authorship, and this is a very similar slide actually to one that she'd shown. Authorship, we have slightly less control over as a rule, because a lot of what we receive has been spontaneously submitted. So there's less influence we can have. So one of my interns recently did this piece of analysis, and the pie chart on the left there, you can see the areas that we devote our research to. So this is a study just looking at research articles over a 4-year period. And you can see that Africa, this is sub-Saharan Africa in green, I think particularly, we devote about 2/3 of the research articles to sub-Saharan Africa. About a third are sort of multi-region studies, and then another third are from other regions from around the world. But then if you look at the panel on the right, you can see that within those articles about Africa, again, only around 50% of the authors of those articles are actually coming from a low middle income country, not specifically an African country, but any low middle income country. In this particular case, one would assume they were probably from an African country. So I think, yeah, similar to what Bethany was showing, you can see that there are issues. So what can we actually do about that as a journal? Well, there are some things that we can do, and I've tried a couple recently. We published an editorial a couple of years ago, and we actually had stated in that editorial that for research papers, so this is primary research papers, if there are no authors based in the country of study, it's very unlikely to be published in Lancet Global Health. So as a journal editor, you can make that decision. If you see a paper coming in, it's been done in a country, all the authors are from probably a high income country, we can choose not to pursue that, or we can question it. I think, as Bethany alluded to with the high income country institutions, question, why is that? How can that be that research has been done with no involvement of local researchers? But then we wanted to explore also in this editorial what happens with secondary analyses of publicly available data sets. So much of what we publish, the data have come from things like demographic and health surveys. Those are publicly available. People from high income countries are able to access the data. They have the resources to analyze them. You know, is it okay to have no authors from a country on that type of authorship? So again, sort of going back to our advisory board, these are the people we rely on to making sure we're kind of making the right strategic decisions and policies. We actually asked them the question, is it wrong to have no authors from the country of study on a paper which is a secondary analysis of publicly available data? And the answers were quite interesting. So some of them said, yes, it's completely wrong. You know, how can external researchers know about A, the quality of the data collection, and B, the context of that country, so that you can actually interpret the findings appropriately. But then some said, no, it's not always wrong. What if those data are just there? No one has studied them. if the high income country authors have the resources to analyse, then maybe they should, because they could be useful for the country. And then others said, well, it's a bit nuanced, you know, maybe yes, maybe no, but whatever the case, perhaps in the instance where high income country authors have done the analyses, what they don't want to do is then kind of fish around for a name from that just to add to the paper, just to make it look kind of authentic. So it mustn't become tokenistic. So we thought that was kind of an interesting set of thoughts from our advisory board. So what we said in this editorial, that we weren't going to outright ban such submissions. So these are, as I say, secondary analyses. However, we strongly encourage those embarking on such analyses to recruit and involve at all stages of the research and publication process suitably qualified local researchers. And then we invited readers who'd successfully negotiated this process to share their experiences. So again, as an editor, you can kind of make these statements and publish them and hopefully try and encourage best practice. So that's for research that's spontaneously submitted. Of course, we also have material that is commissioned. So things like our series, our commissions, some of our commentaries that are linked to research articles, these are actually commissioned by the editors. So we invite people to actually write them. And again, there you have much more control. So in this comment that was published last year as part of the Lancet Women issue, we made a commitment to inviting at least 50% women and 50% Global South contributors on this type of work. So again, just takes a little bit of thought, a little bit more effort, but we can do certain things with invited material. We've also published a little bit like some of the work that Bethany's done, some research or some thought pieces on what the global health partners can do. And so from this commentary that was published about 3 years ago, the authors suggested some key actions for key players, and the journal's obligations they listed here were ensuring that fee waivers for open access publication were available. So Lancet Global Health is an open access journal, for example, so there shouldn't be any barriers to people from low middle income countries reading the work. But of course, if you're submitting to an open access journal, you usually need to pay a fee. So it's important to make sure that that is not a barrier to people wanting to publish from low middle income countries. So we have fee waivers available where the funding has come from a low middle income country. One of the other suggestions was to mandate that publications from research done in LMICs includes authors who are living and working in those countries. So again, we've made that commitment. And then another one was to consider an extended development and mentoring role for authors in LMICs, and that's quite an interesting one, and it's something that the Lancet Psychiatry is actually exploring. It's doing what it's calling an editorial board development program. So it's taking young psychiatry researchers, mostly from low middle income countries, and it's kind of doing some mentoring with them. So it's asking them to peer review 4 to 6 papers a year. Then the Lancet Psychiatry editors give them those reviewers feedback on their reviews, and sometimes they also get training from an experienced peer reviewer. They're asked to recommend and recruit peer reviewers from their country, so we're trying to make it a sustainable process. They're invited to write comment and correspondence pieces to sort of raise their profile or the profile of the area that they're studying, and then recommend topics and potential authors for reviews to be commissioned. So I think that's quite a nice, it's sort of a pilot at the moment, the journal's seeing how that one goes, but I think, again, journals can, you know, if they have the will, do something a bit further in terms of trying to do a little bit of capacity building. There are also lots of online resources available. So our publisher Elsevier has a free online portal that I think you know, can be very helpful for people starting out in areas where the mentoring and the training in research, well, the research process, preparation, writing, and the publication process is less available. These types of resources can be quite useful. And then finally, as journals editors, we can also do some outreach. So for example, we can participate in webinars like this one. I often go to meetings and offer to carry out workshops. So at the AfriHealth meeting that Peter's involved with, I've done a couple of half-day workshops on publishing in high income and in high impact journals. We're also very happy to go to institutions and to talk to faculty and staff about the research and publishing process. And then we actually have an open editorial meeting in our own office. So if anybody should be in London, they're welcome to come and attend the meeting and kind of get an insight into how things happen at a journal like the Lancet. And at the moment, we're also trying to explore how we can offer internships to early career stage researchers from low middle income countries. There are obviously some issues. We don't have a huge budget for it, so it's very difficult to be able to afford to fly people over to London and put them up somewhere. So we're trying to explore how we can do that, maybe as a kind of virtual internship, or maybe in collaboration with a university in London that has a lot of international students. So that's a kind of work in progress. But I think I just want to get across that, you know, we can and should be part of this process of trying to increase equity in global health. So thanks very much for listening. I'm now going to hand back over to Keith Martin, who's going to wrap up and field your questions.
Thank you very much, Zoe. And we heard excellent presentations from Dr. Donker and how global health partnerships can address issues of equity. We've heard from Dr. Bethany Gauthier the role of academia, and we've heard just now from Zoe Mullen the role of journals in addressing equity. And what I'm going to do is just run through a few slides with regard to how what we are doing at CUGH in terms of addressing this issue, and then we'll open it up for questions. So please do submit your questions as soon as possible. You can do it online. So as I go to my slides that you can see, the slides that we have here, I took this picture really just to show you a little bit visually in terms of what inequity looks like, because inequity creates structural problems, that power imbalances that reinforces inequities and poor health outcomes. And imagine for a moment looking at the individuals, the people who live in the bottom of this slide. This is in Lagos, Nigeria, a country which is the biggest economy on the continent of Africa. And think of what the power influence those people in the bottom have to the people living in the big apartment buildings on top. So hold that in your mind for a second. And these inequities that we see, these structural imbalances, not only occur within urban settings, they also occur between rural and urban settings too. So it's an intrastate problem as well as an interstate problem. I took this photograph because I was speaking in Washington, D.C. To a university. And I want you to think about, the reason why I brought the slide up is to show that inequities occur within countries too. So this is about 2 miles away, about 3 kilometers away from the capital in Washington, D.C., the richest country in the world. And you've got over 11,000 homeless people. So congresspersons who drive in from the airport in downtown Washington pass by a sea of people who are living on the street, people with mental health care problems. They don't have housing, they don't have access to health care, and they have fallen through the cracks of life. And these people and these issues are frankly not part of the political discourse that we see, at least in this country, and sad to say, around the world in too many places. So what can we do? Well, first of all, take a look at some of the damaging effects. And you heard some of it from our speakers earlier on. But the damaging effects of global health, it really creates deep negative political, social, and economic impacts. And it reinforces itself because if you do the structural inequities we're seeing really creates an inequality of opportunity. And this inequality of opportunity creates poor outcomes. And as a result, we see discrimination and exclusion, and that discrimination and exclusion is reinforced by these structural inequities that exist today. And it can lead quite frankly, that we've seen to significant economic and social instability and conflict. As I said before, inequities are not just an academic challenge. They create a vicious cycle that reinforces itself and reinforces the negative outcomes that we see. So what can be done? So from a political perspective and at a national level, you can really invest in, if your country has the resources to do it, you've got to look at the social determinants of health. That's where you're going to have the biggest impact in trying to address inequities and trying to level the playing field. Things like housing, health coverage, infrastructure, education. Early childhood and K-12 quality education is some of the best buys and powerful investments that countries can make in trying to level the playing field. Removing barriers to post-secondary training, minimum wage, paid maternity and sick leave if you're in a higher income country, and then lower tax rates for the poor and the middle class. But since many of our members that you're on today are from academia, so as we heard earlier from Bethany and from Peter, what can universities do? What can academia do? And Zoe mentioned what academia can do through their research. Let's take a look. First, strengthen the pipeline. Enable your students to be able to visit low-income schools in your neighborhood. Academic institutions can be a significant anchor to address inequities and the social determinants of health right in their backyard. It just requires a bit of leadership, maybe for change in incentives within academia to be able to do this. But it's an incredible opportunity. Expand access to colleges and trade schools and university. Enabling kids in low-income environments to visit academic institutions. Some of them have never had anybody in their cohort or within their families and environment who've ever achieved post-secondary, who've ever gone to a post-secondary institution. It's not part of their world. Why don't we break those barriers down and give students in low-income opportunities or low-income communities a way to be able to see what's actually behind the ivory tower? That doesn't cost much, and it can be incredibly important. The other is for low-income students when they're in academic institutions. They've run all manner of challenges to be able to stay. Even though they get in, there are huge challenges for them to be able to stay and be able to retain in their studies. So peer-to-peer support is important. Increasing student aid. Some top-up grants that enable students not to have to work in jobs to be able to pay for their university, which takes their time away from doing their studies. That really compromises their ability to stay in school, and many drop out as a result of that. Focusing on students that are from minority and disadvantaged communities is extremely important. And finally, if you're in academia and you're in places like medicine and nursing and dentistry, law and veterinary sciences, having experiential learning opportunities, supervised opportunities to provide care for people in low-resource communities can be an incredibly powerful way to not only enhance the educational mandate of universities, but would enable these communities to have access to services that they could never afford. And we've seen some incredibly clever partnerships between dentistry and nursing and medicine, veterinary sciences, and law to be able to do this, to be able to provide supervised services from senior students to communities that would never have access to these services. And in developing nations, we heard from Peter the issue of strengthening of what partnerships can do to be able to be fair and more equitable. But I want you to think about this. If you look at the list of the worst performing countries in the world, what they all have in common is that they all have in common weak public institutions. In global health, we fail to actually address capacity building in public institutions, to partner with governments, to be able to strengthen not only ministries of health, but we've got to have, any stable country has to have an effective justice system, a finance system, public works and the environment, and yes, indeed, health. But they all have to be there as a foundation for state stability. Without that, countries have an almost impossible time to be able to deliver the public goods their citizens ask. So training, sustaining, and retaining skilled health workers can be a way to do this. And at CUGH, we've created a capacity building platform to do just that, to link trainers up with the training needs in low resource institutions. Don't forget human rights mechanisms. We have obligations to act, but we have responsibilities to protect, but we don't have obligations to act, and we don't have the enforcement mechanisms that back up judicial regulations that are on paper, but are not functional. So I can go through all those a bit later in the Q&A, but let's make sure we focus on not only our thinking in the biomedical field, but make sure we look at the political and social determinants of health. Peter's looked at the academic partnership issues. Just want to reinforce that, is that this is a picture taken from a big teaching hospital in a country in sub-Saharan Africa. It's an institution that high-income countries have had relationships with in teaching, in experiential learning and research for decades. But on your left is the outpatient treatment center, and on your right is where our colleagues in that institution, they live, they train, and they study. The windows are broken, the toilets are broken, and the curtains are not there. So they live in very difficult circumstances as they try very hard to care for their citizens. My point is simply this: if you have a partnership and are from a high-income country and you're working with a low and low-middle-income country, for heaven's sake, make sure that that partnership can be leveraged to address the needs that that partner of yours asks for in terms of being able to enable them to be able to provide the care that they want to provide. So they'll guide us in what they want, but make sure we're there to help them as they ask us to. Finally, we cannot do any harm in our relationships. As I said, the bulk of the benefits, if we have a relationship between a high-income country and a low-income country, the bulk of those benefits should go to the low-income country, not to us. It is a partnership, but it's not ethical for us to be taking the lion's share of the benefits. And there are many opportunities we can get to in doing that. At CUGH, with Bethany, we're working to do that, and Zoe has done some incredible work in providing training opportunities for research publication. I would just share a couple of things, though, on this for universities. Enable your colleagues in low-income countries to access your libraries, access the assets you have, it's a simple way that you can do that, and also assist with grant writing, strengthening their own abilities to write grants so they can get their own grants and be more competitive. And I mentioned the work we're doing in our capacity building subcommittee with Peter was the founding chair of AfriHealth. We have a working group with them and other working groups on equity that Bethany leads, on law, oral health, palliative care, and many others. Take a look at our website and see those opportunities at cugh.org. And I mentioned the writing workshops that Zoe has given. So finally, and this is my last slide, for us to be able to do justice to the sea of incredible research that's produced, you've got to get political. You have to move the political needle. Many of us in academia, or many in academia, are understandably it's wary about getting involved in the political process. You don't have to be partisan, but if you really want to make change, we've got to get political. You've got to be able to bridge the gap between what is known and what is being used in policies to do our best to make sure that the policies that are produced are evidence-based. And CUGH has a program called the Network of Academic Advisors here in the United States, where we link academics with policymakers. So with that, I will stop, and then we'll get right to questions, and they're coming in. So thank you very much for those questions. So the first one I'd like to be able to ask is to be able to get those. Is to be able to ask. I'd like to ask Peter in terms of the role of medical societies and academic societies. What roles should they be playing to address inequity, to reduce inequities? Peter, over to you.
Hi, thank you very much, Keith, for that question. I assume that by that question you are referring to medical societies both in low-income countries and high-income countries.
Correct.
Yeah, so I think medical societies should ensure that there is an ethical approach to partnerships, and they are highly organized and can influence their members who are involved in some of these global partnerships to ensure that there is fairness on both sides, that those in the low middle income countries also provide the needed leadership and support to their partners in terms of participating in some of the discussions that may be difficult for, let's say, a weak institution or weak academics who may not be political enough to be able to have the difficult conversations that are often necessary to have in setting out the terms for these partnerships. Thank you.
Great. Thank you very much, Peter. So this question is for you, Bethany, and it comes from Anna. And Anna wants to know that how basically international researchers from low-income countries can be able to have a better ability to access grants. Grants are being given to high-income countries to do research in low-income countries. What do we need to do to be able to increase the number of grants flowing to low-income countries for research done in those countries?
So, I mean, I think there's a variety of answers to that. One, more structurally, I think all of us, no matter where we're positioned, should be talking with different funding organizations about the importance of, one, valuing equity. So if you're going to fund me, part of what should be reviewed is how I have partnered and how I've demonstrated that I value strengthening all members of my team in that partnership. And I think funders should be valuing that and review. And I think if they start valuing that, then there will be increased competitiveness from all collaborators to be applying for grants. On a more individual level, and what I'd encourage you, if that is your goal, about 10 years ago when I started this career as a global health academic, I sat down with a mentor who said, today you are not competitive for grants, and these are the reasons why. But 5 years from now, you'd be competitive for these types of grants if you do A, B, and C. And part of that is why I talk about authorship equity, because having publications that show your leadership and work is going to be an important precursor. And so, one of the things you can do on an individual level is to try and map out where are you now in terms of your individual competitiveness and what steps you need to take. And I think identifying a strong mentor for that is important for that. And then the third is also on the advocacy side. I think part of the challenge is if most of the research funding for research in low and middle income countries is coming from high income countries, that is going to be a perpetuated challenge, that what you're describing will be perpetuated. The more that we can encourage governments to fund research within their own countries, and I think there's certainly governments who have done that more readily than others, at that point, I think that also shifts the dynamic a bit. And so definitely putting pressures on all these sides is going to be important to improve the representation and leadership in terms of grant funding.
Thank you, Bethany. So, Zoe, this is a comment and a question for you. The comment from Jean says it's an excellent idea to have students internships at the Lancet, and they can take that knowledge, that manuscript development insights back to their home countries. We certainly hope other journals take your leadership in that effort. So the question for you comes from Rahul. Rahul wants to know how you can balance equity with the corruption and nepotism in some low to middle income countries, particularly for high income country researchers who don't understand the language or culture of the host country. And Rahul prefaces that by saying he has worked in India for 3 decades.
Wow. Oh, tricky one. Thank you, Rel. I'm not sure I'm the best person to tackle that one, actually. I mean, Keith, you've spoken of and you've focused much of CUGH's work in the past year on corruption. I know this is a topic of yours, actually, and it is kind of the elephant in the room, isn't it? I wrote an editorial on it recently because we know that this happens, and we have to start pointing it out, I think. And me as an editor, again, my role in this is fairly limited, but I think, I've certainly written about it. And but maybe Keith, maybe you could comment on this, or maybe Peter.
Yeah. Thank you, Zoe. I will. I'm going to give it to Peter first, and then I'm going to just make a couple of comments. I know, Peter, do you want to add anything to Zoe, and then I'll make a couple of comments if I may? Peter, any questions about the role of equity and corruption and nepotism?
Well, these are difficult issues. Corruption, nepotism. All I can say is that we should all aim for excellence, and I think if we do have open structures which are subject to review in an open way, then it will be the first step in fighting corruption and nepotism. I think that's what I want to say for now. You have more to say, Keith.
Yeah, no, thanks, Peter. And so to Zoe's question, and so as I said in my comments, any country can be subject to corruption. Weak public institutions enable this to happen. It enables corrupt leaders to capture the levers of power in countries and engage in what's currently taking place, which I call grand theft. Grand theft in the amount of $1.5 to $3 trillion a year. That's right, $1 trillion a year is stolen around the world, primarily from low-income countries. Now, that money is not parked in Luanda, in Angola. That money is parked in Geneva, in London, in Vancouver, in New York. So, and in places in the world where you can have very weak oversight and you can bury the money, and that's what's happening. So high-income countries, we are more than half the problem in the massive theft of assets from low-income countries because we're turning a blind eye from harboring those ill-gotten gains, and we're taking it in our own countries, and we're enabling this to happen. So we do a pathetic response, frankly, as high-income countries, to be able to stop the massive wholesale theft of resources from low-income countries. And we need to change that. And there's things that can be done. If you're interested, look at Transparency International and others who've done a great job of outlining what countries should do politically to be able to put in the rules that prevent corrupt individuals from stealing money from low-resource countries. And that happens between the people in those countries and high-income countries. So there's lots to talk there, but that's perhaps for another day. A couple of questions that we still have going before we move on. What recommendations this comes from Dennis, what recommendations does the panel have to change institutional culture that actually discourages research? So Dennis is in Mexico, and he is wondering what can be done to stop institutions from actually discouraging research? I don't know who wants to take that.
I suppose let me have a go first, Peter here. I think the part of the problem is that, especially for many academic institutions in low-income countries, that because of the inadequate numbers of faculty, there seems to be quite a high demand for classroom teaching and instruction, and so not much attention is paid to giving a time for faculty to spend on research, and so we need to. I think Bethany made reference to that somewhat, to just begin to engage with the leadership of the institutions so that they will place a much higher premium on research and see the need to grant time to faculty to address, to spend on research. And I think we also need to encourage them to hire more faculty. It is a problem, I think, in most LICs. Thank you.
Thank you very much. Thank you, Peter, very much. So just to let everybody know, the slides will be available online at CUGH.org, because that is a number of questions. So you will have access to everybody's presentation at that time. Another question we just want to ask here, again, this one is for you, Peter. It comes from a researcher, and the researcher wants to know what solutions can be done in terms of power imbalances between indigenous researchers and the study population in a country. If you have an indigenous researcher, can the researcher, are there steps that the researcher can take to ensure that equity principles are taken up throughout the research process? Peter, that was for you.
Yeah. Okay. So I think, well, I think it's again, it's starting. Indigenous researchers or local researchers should never underestimate their role and their potential. That they are, even though they may not have the resources, the money, they are powerful, and they are needed to ensure that the research is successful. I think it's just a respectful engagement with your partner in letting them know that from high-income country, letting them know about what has to be done, and really it's an open, honest engagement. Make sure you have everything documented, the steps to be taken there, and the role that everyone is going to be playing. I think I cannot say anything further than that. It's just talk to make sure that every problem is tackled and resolved.
Great. Thank you very much, Peter. We have a couple minutes left. I just want to turn it over to everybody. Maybe we'll go in reverse order with Zoe, Bethany, and Peter to give the closing comments. I just want to say that Larry, one of our partners, just to draw your attention to this issue, one of the issues of inequity is access to palliative care for patients suffering from cancer, and the International Cancer Expert Corps, ICEC, is doing a great work in that field. I just draw your attention to their work. For those of you who are interested, it's a sort of it's certainly a neglected area in global health, so please take a look if you're an oncologist interested in enabling people to access radiotherapy for a number of malignancies. So for closing comments, Zoe, I'll turn it over to you for some short comments, and then Bethany, and then Peter. Zoe, over to you.
Oh, thanks, Keith. I think maybe the message I just want to get across is that, you know, certainly from a journal editor's point of view, you know, I'm quite removed from the realities on the ground. So I need people to tell me, you know, what the problems are and maybe what some of the potential solutions could be. You know, given you know, from a journal's point of view, my relatively restricted role. But you know, we need to know these things. So I would really encourage people to engage with us, email us, write us letters to the editor, come and see me at conferences, because I really want to help to understand, first of all, what's going on, and then try and explore any solutions together. So just, don't be afraid of big bad editors. We're not nasty, we're nice, and I'd love to hear from you.
Thank you very much, Zoe. Bethany?
So 2 closing thoughts. One is, I think these conversations have been happening for a while in global health, but I see more movement and traction on it in the last 3 to 5 years. And I think part of that is because folks are shaking cages. And so one thought is, let's shake cages. Let's, if we see things that are suspect or concerning, let's raise our voices and call them out. Let's talk about strategies to do better. I think social media and connecting us through web forums is a great way to find allies in this and to really push the needle. So please shake cages. And if there are other places where I can help shake cages align with that, I would love to be engaged. The second is, and this reflects something that Peter commented on in his presentation, I think on an individual level, something I challenge myself to do that we can all challenge ourselves to do is setting goals for the next year and the next 5 years of what we hope to do differently or better, and trying to identify concrete strategies to do those things in this space would help each of us as individuals try and improve how we collaborate, or again, back to the question, if the goal is to get grants, finding strategies to get those grants. And if we can support each other in our own individual goals, I think that will also help us move this field forward.
Great. Thank you very much, Bethany. And Peter, you have the last word.
Okay, so while the discussion on equity has mainly been focused on high income and low income countries, I think we also should address inequity in country partnerships. For example, a more endowed institution may partner with a less endowed institution in, say, low LIC country. And these same principles must apply, fairness and support. And then I think, Keith, I remember the CUGH and AfroHealth was developing a database whose purpose was to identify what the needs of low-income countries, institutions, and high-income countries and their strengths, and see how these could be matched. And I think this would be a useful opportunity for you to actually roll that out so that more people will have access to this database if it's already available. So on that note, I'll say thank you very much all. I've enjoyed this. I've learned a lot also from my colleague.
Thank you so much, Peter. And before I just close off here, I'd be remiss, and Dr. Rabin had reminded me here on our notes that to please take a look at the paper that the Global Medical Education Working Group had published last year in Academic Medicine called Reconfiguring a One-Way Street, a position paper on why and how to improve equity in global physician training. And look for Dr. Tracy Rabin and that paper. That could be very informative. Thank you, Tracy. And much thanks again to Zoe Mullen, the editor of Lancet Global Health, Dr. Bethany Het-Gauthier, Associate Professor of Harvard Chan School of Public Health, and Dr. Peter Donker in Kumasi, Ghana, the former Vice Principal of the university. And I really want to thank everybody online for joining us for this webinar series, and we look forward to expanding it. This presentation will be on CUGH's website at cugh.org. And please, as Peter mentioned, take a look at our CUGHcapacitybuilding.org website, which will help, we hope, to be able to strengthen training capabilities in low resource settings. So with that, thank you for joining us, everyone, on this Lancet CUGH Global Health webinar series.